Happy One Health Day. Welcome to those of you online. We hopefully will have a few more stragglers coming in to be here in person as well. So, One Health Day is pretty exciting. And it's exciting that we have at least the capability of being in person or doing some things in person this year with the pandemic. One Health Day actually started back in 2016, and it was started by the One Health Commission, the One Health Platform Foundation, and One Health Initiative team. It's international. So One Health Day is officially celebrated around the world every single year on November 3rd. And that's pretty awesome that it's not just us celebrating this day. It's everybody celebrating this day. The goal of One Health is to build the culture necessary for a sea of change on how planetary health challenges are assessed and addressed, and how professionals exchange information across disciplines. One Health Day is meant to bring global attention to the need for One Health collaborations and allow the world to see these collaborations in action. The One Health Day campaign is designed to engage as many individuals as possible from as many arenas as possible in One Health education and awareness events, and to generate an inspiring array of projects worldwide. Here at UT, we have the One Health Initiative. Hopefully, all of you, or most of you, have heard of the One Health Initiative by this point in time. But for those of you who haven't, our motto, our goal, is uniting disciplines to protect and promote the health of life on Earth. We want to do, and what we are doing is reaching out across the University of Tennessee and beyond, forming and strengthening connections with the goal of solving issues. So what issues might we have here in Tennessee that would be One Health? Well, first of all, what is One Health? One Health is looking at how the environment, animals, plants, and humans are interconnected, and how the health of any one of those is impacted by the health of the others. We have a lot of issues that qualify for that in Tennessee. And here's just a couple examples. Food insecurity. Do you believe that there are people who don't have enough food to eat here in Tennessee? It seems kind of crazy, right? But it is a very real issue that we're having. Chronic wasting disease. That's a disease in white-tailed deer. How is that One Health? Well, a lot of people hunt and rely on that as part of their food. It's also part of our culture in our state. And we also have to consider that if this prion, this misfolded protein, is having such a dramatic impact on causing a disease in this animal, what is going to happen to that species? And how might it affect other species? What happens when you take that species out of the environment? How does that impact us? We have Thousand Oaks cankers. This is a fungus carried by a walnut twig beetle, and it's killing black walnut trees, including in the Great Smoky Mountain National Park. And it's not the only one killing trees. We have the emerald ash borer, an exotic beetle that's not even supposed to be here. And it also is killing trees, including in the Smokies. We have the Asian longhorn tick impacting our cattle, as well as other species. But this is a huge issue for the livestock industry. Of course, we are all aware of the opioid crisis, and Tennessee is definitely having severe issues with the opioid crisis. Along with the pandemic and the opioid crisis and everything else, we have a mental health crisis, which is probably impacting rural communities even more than elsewhere. So we need to be reaching out. But we've got to realize our problems are not our own. These aren't problems that we're only experiencing here in Tennessee. Not at all. They're being experienced elsewhere. And problems that are being experienced elsewhere, like in Australia, Brazil, Canada, anywhere else, we similarly experience them here. They impact us. Just think about some of the things that we've been experiencing lately. We've had fires, a lot of fires. And those fires on the West Coast, for example, have been impacting our air quality here on the East Coast. When the fires in Australia were going on, I was in the southernmost part of New Zealand, and the air quality was being impacted there. But it's not just that. It's not just the air quality. It's that those fires are taking out species of animals, of plants. We're seeing a lot of devastation, human lives lost, property destroyed, a lot of impact. And these are all One Health issues. And over the past year and a half now, we have watched a virus blanket our earth. And now more than 5 million people have lost their lives to this virus. And we've also lost other lives too, because there have been lots of animal lives that have been impacted as well. But if we're waiting until these pandemics, these disasters happen, we're only being reactive. And when we're being reactive, we're waiting until it's too late to do something. That's not the time to do something, because that is when it becomes super costly to try to do something. Not only costly financially, but costly in lives. So we need to stop being only reactive, and we need to become proactive. So we're taking command with a One Health initiative and building it within the areas of education, research, and outreach. In the area of education, we have initiated a minor in One Health. And you might say, why a minor? Why not a major? It's simple, because One Health is about bringing disciplines together. We've got to have people lending their expertise in architecture, engineering, communications, policy, public health, human health, animal health, and the list goes on. We've got to have all of these, including those areas that you don't always think about, like historians, communication experts, definitely. We've got to have those to work and to put these teams together. It's super important. Thus, it is critical that students get their major in what they want to be an expert in, but then they minor in One Health so that they can learn about some of these One Health issues. They can learn to be good team members. They can learn how to lead teams. These are important skill sets to acquire in order to work smoothly on a One Health team. We also put research teams together because sometimes they might be brand new ones, but most often it means building upon existing research areas to strengthen what we already have going on here at UT. We have amazing researchers, and our goal is to help them make their research stronger and help them build their teams. For outreach, we do a lot of outreach. For example, Heather Sedges, a faculty member and OHI scholar in UT Extension, is leading us in mental health outreach. In fact, she received a large grant specifically to address rural mental health. We're also partnering with folks in our state government, as well as our 4-H folks and extension agents, to build a One Health K through 12 program that can be taken into schools, especially those in rural communities. And we can teach kids about One Health and the connection of humans, environment, plants, and animals. And I always say, if I can get people to understand one thing, it would be something as simple as biodiversity matters, because that's our foundation. It's the foundation upon which life exists. The stronger the biodiversity, the stronger and healthier we are. And when we start to take out species of animals and plants, yeah, sometimes they get filled in with exotic species. But either way, our foundation starts to get weak and crumble, and we start to have problems. And pretty soon, we have catastrophes. So if we can keep that strong foundation, we can avoid a lot of these catastrophes. We've got to have a strong foundation. We've got to have a strong environment, good water quality, good soil. We've got to have good air quality. We've got to have strength in biodiversity of species. We have to have these things. So today our theme is climate change. And I realize that climate change is a very broad topic, but we hope to touch upon an assortment of contributions to climate change and the resulting impacts. Likely today, you will hear some things that are familiar to you, but perhaps you will also hear some things that you had not previously thought of, or maybe even heard of. It was really in the early 19th century that we started thinking about natural greenhouse effect. And by the late 19th century, we were starting to think, you know what? Human emissions of greenhouse gases could change the climate. And then we fast forward a bit and we look at the 1960s, and we have some evidence of the warming effect of carbon dioxide gas being more increasingly convincing. The 1990s, there was a consensus position formed that greenhouse gases were involved in most climate changes and that human-caused emissions were bringing discernible global warming. And since the 1990s, we have started modeling climate change and putting numbers to it, not thinking about it as one cause anymore or one result, but looking at all of the factors involved and all of the potential results. So today, I'm hoping that there's a sense that people are feeling the impact intensely enough that they finally acknowledge that climate change is real and that they want to do something about it. So with that, we have some amazing experts on climate change, including folks who work here at UT. Our first speaker is Christy Ebi, presenting how climate change affects health.